Hello, I'm a light of faith. I'll be your instructor at the NSC 318, titled Spirituality and Spiritual Care in Nursing. As a way of introduction, I would like to make you to understand that your assessments, your tests, your assignments are very important. They all add up to what is going to make you to make good grades in this course. If you have questions on any of the slides, please feel free to email me, send me a message on chatbot, or you send message on your portal. I'll have access to all of that. I'll be willing to answer your questions. I would like you to be specific when you're asking me any question, especially concerning a particular slide. I want slide page, the title of the slide, it should be noted so that I'll easily reflect on it. I'll also encourage you to take your studies seriously. You have registered for this course and it is of utmost joy if you pass in landslide victory. I wish you all the best. Spirituality and spiritual care in nursing is a very important sphere of nursing. When we talk of spirituality, we are speaking of an aspect of humanity that is seeking ultimate meaning and purpose to life. You want to have a sense of something that is bigger than what you believe in. Spiritual needs and spirituality are often mistakenly equated with religion, but it has a broader meaning to life. The elements of spirituality include faith, meaning, love, belonging, forgiveness, and connectedness. It extends beyond the boundary of formalized religion and therefore is relevant to everyone, even those who do not have any religious faith. You don't have to necessarily be religious, but good religious care can be spiritual. And for a nurse to treat a patient from the aspect of spirituality, the nurse must have a deeper understanding of his spirituality. Spiritual care offers a space in which individuals and their needs are regarded as central. Offer person-centered care rather than staff or system-centered care. You elicit and honor an individual's story. You want to listen to everyone. You want to feel their pain. There's a show of empathy. You want to put yourself in their shoes so that you'll be able to administer the right treatment to them, the right spiritual treatment, the treatment of their minds. You join with them in their pain, in their darkness, in their uncertainty. You are able to see into what they are feeling. It also focuses on autonomy, self-management, rather than dependence and direction, and is characterized by an equitable, responsible, and non-judgmental relationship between two human beings. Spiritual development spans across one's life, from childhood to adulthood. As a child, you are exposed to a lot of beliefs. You are exposed to so much spirituality. You want to explore. You want to see what is there. At early adulthood, you are establishing a spiritual identity. You want to interact with that spirituality. You want to integrate it into your life. That spirituality determines how you are going to live your life. And then you go into deepening your spirituality and using it to face life challenges. In nursing, there are a lot of beliefs, religious influences, cultural influences on nursing. But every aspect of spirituality must be viewed from these two points, because you'll be able to interact with your patients on that level. Their cultural understanding, their religious understanding. It is crucial for everyone to be culturally and religious competent so that they will be able to gain effective and compassionate care for their patients. Nurses should consider the spiritual needs of patients as an element of holistic care. In order for the nurse to take care of the caregiver from a spiritual point, he or she is expected to be aware of his or her spiritual dimension and to have a perspective that can evaluate the spiritual coping skills of the patient. The nurse is expected to assess, you diagnose, you plan, you implement, you evaluate your patient. You evaluate the ongoing assessment. You evaluate the outcomes of the care that you are giving to your patient. You must consider the cultural bias of the patient. You must consider even the religion the patient is practicing. You must listen it attentively, and you must be ready to collaborate with other medical personnel. And do not forget to document everything, both the care and the goals and the achievements. Collaboration in spiritual care is essential. And what do you mean? It helps you to provide a holistic patient-centered care in which you, as a nurse, you are working with a physician, you're working with a psychotherapist, you're working with physiotherapists, you're working with social workers. You even work with pastors, you work with counselors, you work with imams, so that you'll be able to achieve a holistic care for your patient. There are a lot of ethical issues involved in spiritual care. Number one, you must be professionally competent. It's not an aspect of care that you just dabble into. You must be trained. You must respect the autonomy of your patients. Your patients are one of their kind. You don't compare them to each other. You listen. That's why you must be active listener. There's an empathy in your heart for your patients. Treat them as one of their kinds. You must be sensitive to their cultures. You must have boundaries. Don't push them to say everything. There must be confidentiality. Whatever they tell you, you are not supposed to share with somebody else. In assessing spiritual needs, after you have given spiritual needs and you're trying to assess is it effective, you must establish a trust relationship for you to create a safe environment for your patients. You must use assessment tools such as FICA and HO, and you must check the faith and belief of your patient. You must understand the concerns and fears of your patient, and you must understand the physical and emotional well-being of your patient. There are some theories and models that are attached to spiritual well-being in illness. We have the biopsychosocial model, spiritual distress and well-being model, the Fowler stages of faith development, the contextual model of spirituality, the spiritual care model, the transactional model of stress and coping, the wheel of life model, the grief and loss model, and then lastly the hope theory. All of this will be treated in your upcoming classes. Spirituality versus humanism patient. This concept play important roles in patient care as they approach the understanding of human experience and well-being from different perspectives. It's just, in summary, it's saying spirituality gives personal meaning and connection, focuses on personal meaning, humanism focuses on the human welfare and dignity. And the role in care of spirituality is that you assess your patients from the spiritual aspects, while humanism, you assess your patients from the ethical aspects. Policies in spiritual care. Number one policy that you must know is that health as a state of complete physical, mental, spiritual, and social well-being, and not merely the absence of diseases or infirmity. A lot of people don't have disease and infirmity that can be easily seen, but their minds are sick. You must be compassionate and safe to be spoken to. You must be person-centered for you to achieve physical, mental, physiological, social, and spiritual well-being of your patient. And you must recognize that everyone has spiritual care needs that may require to be met when facing illness or uncertainty. And those of different beliefs or those who do not wish to associate with any particular belief system or faith will have various spiritual care needs and will seek to meet these appropriately and timely. Spiritual care helps individuals and communities to find hope, meaning in the midst of illness, uncertainty, affirming that tears and laughter, pain and joy are part of normal human experiences. Competencies in spiritual care, education and training. You have the intrapersonal spirituality, interpersonal spirituality, spiritual care in the form of assessment and planning, spiritual care in the form of intervention and evaluation. All of these 4 competencies must be developed before you can administer spiritual care to the patient. Oh well, I'll be sharing my course materials later, and I'll see you in the next class. Thank you for your time.